How's it going, class? Welcome back to my video part 2, and this is for my procedure I have chosen is reduction mammoplasty for surgical procedures 140. So pretty much what I want to start off is I want to kind of give you like an explanation of what the purpose of a mammoplasty is. So reduction mammoplasty. That's what I'm correction. Sorry. So first off, breast reduction, also known as reduction mammoplasty, is a surgical procedure that aims to reduce the size and weight of the breasts. The procedure kind of involves removing excessive breast tissue, fat, and skin to achieve a more proportionate breast size and shape. So real quick now, what I want to do is I want to go ahead and give you, sorry, it's my dog. I want to go ahead and give you a tour of my setup. So here we are here. There we go. So I'll walk you through a little bit. So right here to the left side, what we have here is we have my sterile towels, and we have our sterile towels, and okay, we have our sterile towels here. I am sorry about that. I have an incision pen here in case the surgeon needs to mark under, where he needs to make the incision. And we also have, I also have here a 10 millimeter syringe. I have my Yankauer set, my disposable Yankauer, and then I have another surgical Yankauer suction tip. I have my tubing. I have my my irrigation container and nozzle there. I have some lab sponges. I have some Raytex sponges here. So now let's go over with a little bit of the stuff we have. So I just want to give you a heads up on any piece of something like this of forceps. You will hand to the surgeon always. Ring first, okay? Just like that. But anyways, this is a cryo forceps. Some other names for it: hemostat, snap, clamp, Kelly forceps, stat. A little bit of description: these are curved or straight clamps with horizontal serrations that run the complete length of the jaws. Its uses: cryo forceps are used for occluding bleeders before cauterization or litigation. These may also be used for blunt dissection when separating planes and tissues. So we're moving on, and let's go to, these are obviously, of course, you remember, we were just got them doing these. These are the Adson forceps, other names: tonsil Schnitt forceps, fancy clamp, tonsil forceps, TNA, TNA clamp, stuff like that. And like I said, always hand to the surgeon, rings first. So a little bit about them again. Like I said, their use for that is Adson forceps clamp small vessels in deep wound or whole tonsil sponges. These also may be used to create a tie on a passer. So, all right. So we're moving on. Now we have the straight male scissors right there. A little bit of a tip here. Safety-wise, if you're using this with the patients, you always want to inspect the jaws to make sure there's no nicks, burrs, or anything that can damage skin tissue and stuff like that. But of course, always, if hand over, surgeons just like this. And a little bit, other names of suture scissors, but these are used for cutting sutures. That's what those are for. So now we're moving on to the curved Metzenbaum scissors. These are one of my favorite tools here. So again, same thing with these. Always inspect the jaws to make sure no nicks, burrs, or anything. that can damage the skin. And always make sure to hand to the surgeon, ring first. Okay, the uses for that is these are used to dissect and undermine delicate tissues. So now let's move on to the number knife 3 handle here. So that's the number knife 3 handle, and with the blade being on, I would make sure that you use a male suture needle holder to put the blade on, just for safety so you don't cut your skin. And then as you're always passing, make sure to handle straight to the surgeon, grab, release. Okay, so and a little bit about the number 3 handle is a description. Number 3 handle holds blades 10, 11, 12, and 15. Its uses: number 3 handles are used to hold various blades to create a scalpel. Scalpels are used to make skin incisions or whatever a fine precision cut is necessary. Okay, now we're moving on. Moving on. Let's see. All right. So now we come to the tooth Adson, or the Adson forceps. So these are, they have a tooth in the front, and these are pretty much, these uses are used to align the edges of the wound, stapling of the skin, grasping superficial with steri strips. And they also, these are kind of used, if you can see, maybe we can get a good shot. There we go. These are good for like gripping tissue as dissection keeps going, you know. And with these two, because these have a toothed end, so just make sure and you hand to the surgeon handle first to avoid any punctures in the gloves at all or anything. All right, moving on. Next, we have the DeBankey tissue forceps. So a little bit about these is these instruments are used for delicate tissue and blood vessels. So we're moving on. Moving on. So a little bit more about the DeBankey. Its uses: these are used to grasp numerous types of tissue, commonly used in cardiac, vascular surgery, and gastrointestinal procedures. So now we're going to make our way to the, I want to get to the retractors. Here we go. So let's start with the Army Navy retractors, which are these two sirs right here. As you can see. All right, so a little bit about them. Other code names: Armies, Navies, U.S. retractors. A little bit of description is it is a handheld double-ended retractor with an oval fenestration in the handle with the lateral curve to the blade on each end. One end is longer than the other so that it can be placed deeper into the wound. A little bit the uses are: it is used for retracting a small superficial incision to allow a better exposure. So maybe like under, you know, just about the skin of the breast to pull it maybe, you know. And always make sure and hand to the surgeon. Okay, moving, we're getting there. Whew. Okay, so it looks like we have, next we'll go to the skin hooks here. We have a double skin hook and a single skin hook. These are, you see a good shot right there, and pretty much these are mostly commonly used as skin edge retractors. So maybe taking the edge of these hooks, these little things there, and holding the edge of the skin. That's what they're good for. So now we go to so we're going to a Deaver. So this is kind of what a Deaver retractor looks like. But in this procedure, it calls for a baby Deaver. So these are also handheld retractors as well. These are also a handheld retractor as well. So pretty much what they do is they kind of like retract the wound the breast up a little bit more. So that's those uses are for. So then the next thing I lost, I don't have, but I know we have a male Heger needle holder. Let me give you a better shot of that right there. That's what that is for. So a little bit about that is, its description is a broader jaw that is rounded at the tip of the crisscross pattern on the inner jaws. And its uses, it is used for holding heavy needles when suturing. Real quick, with this bad boy, always make sure that you use these to grip a blade and place it on to there. So just to be on the safe side, so that way you don't cut yourself. You don't cut yourself at all. And I believe, I want to say something like, so I know here is what we have. Here is we have an Israel rake retractor. I want to do a kind of a comparison to a Freeman rake retractor, only because it's kind of similar, only like the edges on here, if you look, are kind of dull, and on the rake, it's like the rake is how do you say, like the prongs are a little bit sharper, kind of like a Volkmann retractor, you know. So pretty much these uses are for use for superficial retracting of the wound edges. That's pretty much it. And the last one I want to talk about is, hold on one second, I'm sorry. So this right here, this puppy right here, it's the last one of my favorite ones right here. I'm sorry for taking up too much time just getting my notes together. So this right there is an Richardson retractor. It's like a handheld, so you know. So, but real quick before I go into that, I just want to say the skin hooks, the rake, and the deaver, always make sure handles are handed to the surgeon first, just for safety, so no punctures, no holes in the gloves. Okay, now back to the Richardson here. So this is, of course, make sure hand first. But a little bit about this. Other names are Rich Retractor. A little bit of description. It has a hollow grip handle with a lateral curve to the blade. The body of the blade is a concave with a crescent-shaped lip that is laterally bent. Its uses primarily it is used for retracting the wound edges. So these are often packed in a set of 3, small, medium, and large. So there is more. So I'm assuming this bad boy is the small. But anyways, what they mean is, so like if we're getting ready for to pull back the breast maybe. So here's the breast, you go under and grab the edge, and then you just grab it, pull up, and then pull. So yeah. But like I said, remember, always hand to the surgeon, handle first. All right, well, that kind of wraps up my part 2 video for my second procedure for reduction mammoplasty. I did the best I could. I hope people like my video. So I hope you appreciate it. I worked hard on it. Thank you very much, and I look forward to hearing feedback. Thank you.